More than 1,100 cataract surgeries have been conducted at taxpayer expense since this former Bed Bath & Beyond location opened as a privately owned surgery clinic late last year. For each procedure, in addition to the doctor's billing fee, which is the same no matter where a surgery takes place, the owners of the clinic receive an $850 overhead fee. Over the first 3 months, those fees added up to almost $1 million to cover the costs of running the clinic. Anything extra is profit.
Is doing more cataract surgeries on the island good? Yes. Is, doctors getting paid for the work that they do important? Yes, it is. Is doing it in this setting, does it have other downstream costs that we're unaware of?
It's not clear whether it costs more, less, or the same for Health P.E.I. to pay private facilities to host surgeries. CBC has asked for any cost analysis that's been done and hasn't received anything in response. It was the same for a legislative committee looking for answers.
The fact that we haven't received those would suggest that government hasn't done those cost-benefit analyses. So I guess the best time now is now to do them.
In the throne speech, government said other procedures could go to private facilities based on the success of the cataract clinic.
It's freed up surgical space in the hospital for more complex procedures, and as we've seen, our output has increased significantly for those procedures, and I think it's working well. So it's a model that's, in my opinion, been around a long time, and I'm not sure why it would raise any eyebrows.
Unions are raising red flags about the further privatization of P.E.I.'s healthcare system. The union representing MRI technicians and lab staff says this will shift emphasis from providing equitable quality care to maximizing profit margins. Another union is urging the province to improve the public delivery of health care, where there is more accountability, transparency, and a qualified, documented level of care.
We should try to truly reform our public system and make it more accountable, make it better, make it faster, because these concerns about access and everything else, they're all perfectly valid. But just washing our hands and saying, fine, we're going private, that feels like a cop-out to me.
But there is talk in government of private facilities for hip and knee replacements, scopes, and funding MRIs at the private clinic under development in Summerside. Kerry Campbell, CBC News, Charlottetown.